we want the scan to be as accurate as possible. So it's very important to remove as much moisture as possible. I'm using a gauze, get as much moisture as possible from the lower teeth. And then we start the scan from the lower jaw. The scanning process can be very fast, but still we want it to be accurate. If you see anywhere there is air bubbles, you want to eliminate all the air bubbles. Fight with the tongue. Just bring your chin up a little bit. And it's also very important, we need at least 2 millimeters below the gingival margin for the technician to be able to make the appliance as accurate as possible. So I always try to keep at least 2 to 3 millimeters below the gingival margin. It's very important to make sure we capture that. Sometimes around the canine areas, that's the more tricky area to capture. But right now, we have almost all of the data, especially in areas that we have some crowdings. That's also one of the trickier areas. And make sure we got all the information. Now we check the scan. Make sure we have enough information. Right now on this canine, as you see, I have around like maybe 1 millimeter. So I just want to scan this part one more time to make sure we have the 2 millimeter below the gingival margin for the proper fabrication of that appliance. That should be perfect. And after some time, you can also teach your staff to do that. Right now, most of the time, my staff already take the scan, take the x-rays. We always take a pan as well to check the joints, check the sinuses, and if there's any major disease or any implants or any major work that has been done, we can visualize. It's a very good report to have. If patients have recent x-rays, we ask them to bring it with themselves. But again, all of these steps can be done by your staff as well, and then you can just double check the scan to make sure everything is perfect. So in terms of the time that you spend on the scanning, it can be very minimal. Now we're gonna go for the upper teeth. Everything good? Good. It's not painful at all, right?
No.
Scanning, not painful, control. Close your mouth a little bit. Sometimes for these last molars are a little bit more tricky, so what we do, we ask the patient to move your jaw away from you. Yeah, beautiful. Capture that final again. Go on the inside as well. One more time. Perfect. Got it. Now one more time on the inside. Edentulous areas can be a little bit trickier. second. Just good, more. Good. Very nice. She doesn't have her wisdom teeth right now. Her wisdom teeth are impacted, but sometimes the patient has a erupted plates on the top, especially that even though they are erupted, but the angle is in a way that it is going to interfere with the path of insertion of the appliance. So in those events, I'm going to ask the technician to omit the last molars, the wisdom teeth, or at least omit the distal half of the last molars, so they're not going to be included into the design of the appliance. So close one last time. And bring your jaw away from me. Perfect. That was a tricky part of it, but it's just one area that this much lack of data, usually technician can fill it up with the software, not a big deal, but in this location, looks like it has some air bubbles. I'm gonna go one last time there. All of the different cards. Thank you for the positions. So now we get to the very interesting part, the record of the bite. As I mentioned before, we're going to record in the multi-bite position. So one time we record the bite in the maximum intercuspation. So we ask the patient to try to bite and bring all the teeth together, maximum bite force. So I want you to bite down, please. Swallow and keep a hard, nice bite. I'm going to move my hand. You're going to keep a nice hard bite. Just move up and down until the bite is captured. Perfect. Open up, please. Bite again, please. Hard, hard, hard. And that's the bite on the opposing side. Now we have all the data for this part. Now we're going to record the second bite. As I mentioned, we're going to get some of these bite forks. They are going to be used to record the bite. We have two different kinds. These are the ones that they keep the teeth in an edge-to-edge position. We have also the ones that are only one side has these notches, and on the other side we can put the George gauge. But I rarely use that. It's only good for people that have a very severe class 2 or severe class 3 malocclusions, and we need to use the George gauge to understand their maximum protrusion and maximum retrusion and find the sweet spot for them. But for majority of patients, using the double-sided bite fork can be sufficient. These bite forks have been designed to take the impression with them, but during the scanning we don't need the distal extension. So what we usually do, we can cut the back part to make it more comfortable for the patient and also easier to scan those areas. So I want you to like that, open up, bite again, open up, bite again. You just have to also make sure that when the patient is biting, they are biting straight. Sometimes the patient have a little bit of cant and they bite on an angle. So open up, bite down, open up, bite down. So her bite is, you can see from the behind, but that's the way that her mandible moves. Sometimes you see the mandible deviates during closure, so we have to be mindful of that because we don't want them to bite in an area that the mandible is being shifted to one side and the other. So right now, feel relaxed and comfortable. Very good. So while she's biting with the tab, just try to use my mirror to reflect her cheek, and for one fast, sweet scan. This one here. These, nice. And do the same thing on this side. To put everything together, and wait for the processing, just to double check that all the areas of interest captured. So see, we have everything captured. The only area that you're missing is the small corner on the upper left last molar, but that area is so tiny that the technician can completely fill up that space. Other than that, all other areas have been completely captured. We have a beautiful scan of the palate as well. So very nice. I'm very happy with the upper scan. As we check the lower scan, the same way, we have all the information. We have the at least 2 millimeters of the safety margin near the gum lines, especially near the crowdings. We have all the information captured. Sometimes you see the patient has a lot of buildups or calculus buildups, or maybe some other bubbles or things that are going to interfere with the quality of the scan. So we make sure that we can do a small little cleaning, with your curette or with your Cavitron, just a little bit of cleaning to remove that. The only area right now that I see there's some buildups in this area, but it's so minimal that not going to interfere with the appliance. But again, the angle of these tools is in a way that it may cause it a little bit more difficult for the lab to make the appliance, because as you know, the appliance is going to be very tight fitting and it's a 3D printed nylon. So we just want to make sure that we have a nice pass of insertion based on the angle of these tubes. I think the technician can make it in a way that we have a nice pass of insertion and exit. But I always communicate to them that if there was any difficulty in that area, they can contact me and they can reach out to me to make a decision to see what we can do to make it fit the best for the patient. But I think in this area, the patient is not going to have any problem with the fit of the appliance, but it's always good to give your technician the chance to communicate with you if there was any issue in that regard. I'm going to check the bite. As we mentioned, we did it in a multi-bite position, so that's her normal bite in the maximum intercuspation. What is the second bite? When you didn't capture the second bite, you have to do it again. No, we're gonna go back so you can pause it. Why didn't you capture?
Go ahead.
This is going to be Jamali. Yeah, so we're capturing the bite with the bite fork. Going up and down. Try to get the back as much as possible. Perfect. So when it's placed on the model, means that it found it. So we go for the other side as well. Try to go to as far back as possible to capture the proper bite. Make sure the patient doesn't move their jaw. It's a little bit uncomfortable, just for a few seconds. One more time. Capture everything here. Processing one more time, open up. Perfect. So right now we are checking the bite as mentioned, we have the bite in the maximum intercuspation, her habitual biting position, and we can see the bite in the position with the bite fork. As you see, the program itself omits the bite fork, but we have at least the 5 millimeter clearance between the upper and lower jaw. That's almost the thickness of the appliance and the intraocclusal space that we need for the fit of the appliance. So that gives the lab the ability to fabricate the appliance in the best way and not gonna have too much difficulty during the titration and adjusting of the appliance in future. So I'm just gonna go ahead and submit the scan. We just have to make sure that we are sending it to the proper lab. So in this case, I'm just gonna submit it to my online account, and then you can export the STL file and send it for the lab for fabrication. Another thing that you can also double check during the initial examination is the fact that if the dental midline and the facial midlines are coinciding. As you know, the appliance has a lip protrusion part that comes out in here. So we just want to make sure that the dental and facial midline are coinciding. And if there is any offset, we have to communicate that offset to the lab. For example, if the dental midline is here, so we're gonna tell the lab that the dental midline is about 4 or 5 millimeter to the left of the facial midline, or vice versa. So you can just take a picture of the patient's face for your reference, or you can just make a note of it and communicate that to the lab. So when the lip part is coming out of the lab for the airway part, it's not going to be canted. That's a very small, minor, thing, but I've seen that if it has not been properly recorded, the patient gonna complain about that in future. So, yeah, that's all. Thank you so much.